Hello people, I'm here again and welcome to this channel. I'm here to offer some guide and also to assist you to your NCLEX exam. And today I want to talk about question banks. So we have so many question banks in the market, but you need to select a question bank that will assist you be able to get questions that actually mimic the NCLEX and questions that are hard, medium difficulty, and some even simple questions, and with actually all sets of questions to include the standalone questions, the select all that apply questions, we have the case studies and all of these. So the question banks that you require, you must be having all these questions so that you can be able to practice a lot of questions that mimic the NCLEX. So also the question bank should be able to grade you and to tell you whether you passed or you did not pass. So for instance, it will give you a certain percentage on how much you scored. The NCLEX would like you to score 50% and above, and therefore if you find yourself scoring less than that, then it means that you still need to work hard. So how much are you supposed to get so that you can be confident enough that you're going to pass the NCLEX? So whichever question bank you're using, it also depends with which question bank and how it is structured, whether it has simple questions, medium, and difficult questions. But most of the questions will try to maintain the simple, the difficult, and the medium questions. So at least if you get a score of more than 75 in a question bank, then you can be sure that definitely I still think that I can make it in the NCLEX. But if you find yourself getting a scores of 50, 54, 46, 38, then just know that still you need to really work hard to understand how to answer the questions and also to understand how to study. So I have a question bank for the nurses, and these are the nurses who are preparing for the NCLEX. It is a good question bank, well selected, so that it meets the standards and also it meets the requirements that are required for you. And this question bank, I've really bargained it for my nurses. These are those people who join my programs. But probably if you're not in our program, we are going to have it higher for you, just a little bit higher. But for those nurses in our programs, for a monthly subscription, we are charging 5,000 Kenya shillings, and this is a question bank. You'll have your own logins. You can be able to work on them anytime, and you'll definitely be able to pass the NCLEX. So for a month subscription, we are charging 5,000 only. For a 3-month subscription, we are charging 9,000 Kenya shillings. That is quite manageable for most of the nurses. And for the annual subscription, we are charging 20,000. These are for the nurses who are in our programs. However, you can still be able to access the question bank, and even when you're not in our programs. However, we are going to have you pay a little bit more, just a little bit more. So not so much that you cannot be able to manage, but I would say that those people in our programs, they get the privilege because I have actually bargained it for them. I have really bargained it. And it is a very good question bank that has a lot of videos for you to watch, and it has all levels of questions, and it is able to score you very well. And also in these question banks, we are still going to have some of our materials in it so that you can be able to also access the clients. It has even a spanner for you, and sometimes I can even give you assignment on the question bank. So it is something that you can really venture in, and you can use it from anywhere in the world because it is a very good one. It is a world-class question bank, and you need one before you take the NCLEX. 3 months to the exam, you need to practice a lot of questions. So kindly just interact with us, send us a message, you can call us, and we are definitely going to give it to you. So you can also encourage your colleagues who wants to use the question banks. And by the way, even when you have colleagues who wants to do the USMLE, this is the exam for doctors who want to work in the US, we still have this question bank for them. It has every course that you need, and it is structured for all of us. So when you have doctors, you're a nurse there, you're a lab tech preparing for the exams, for the international exams, then you can have it. It is one of the best things that has happened to us in 2026. So kindly just inbox, send us a message, and definitely we are going to have you have it. So thank you so much, guys. Thank you for your support. You've really been supportive to us, and thank you for those who are really joining our programs. We appreciate. And as I talk about our programs, we offer the NCLEX tutorial program, and also we offer the guide, the US Nurse Guide. We also source for you employers, and we ensure that you transit well to work in the United States of America. Thank you.